This is Jerry again, and this is Troy and his feet, and this is about 10 minutes later. We really worked rather hard to restore some motion, and now we have approaching 5 degrees of dorsiflexion there. You'll notice it's a little less abrupt, to go into plantar flexion. Now when you stretch your heel cord, you'll be a lot more effective because now you have that range in the joint.
Right. I don't ever feel I can really stretch effectively.
So now look at the amount of varus. Now we can get 30 degrees varus here. Okay. And the cuboid was restricted, and that glides nicely. Fibula was restricted. That's moving nicely. Fibula had no posterior give. There's a little bit there. And abduction, there was none. Look at that. That's pretty remarkable. I don't know, does the camera pick that up? Do you want to move the camera up here?
I would
Yeah, it shows.
Does it show? Mm-hmm. Okay. So now I'm interested in how you feel. And you made the most fascinating comment. When I finished working on calcaneal abduction to improve valgus, there's his valgus motion, his neck, something clicked right below the occiput. And it was midline, right?
Yeah, it was just a little.
Interesting. What did it feel like?
Just like something just let go.
Yeah,
And
interesting.
Just a little bit of a noise.
Interesting. Because you don't see that midline very often, So how does your foot and ankle feel?
Yeah, it feels like I can actually move them.
Okay. Any difference in color? I don't know that I could say
I don't
that.
think anything yet, but
Yeah.
I'd be interested as we go,
Yeah.
as it goes along.
Do you want to walk and give us some feedback?
Well, yeah. Again, I feel like I'm actually moving forward.
Uh-huh.
Just a lot. There's a little bit of almost like a bounce in my step. Like there's a lot less effort for me to go forward.
Uh-huh. And yeah, how is that pivot off the right toe, off the right fifth?
A lot, yeah.
Good.
Is it?
I
Just a damn.
I feel like I have like more of an arch.
Okay.
Almost.
Okay.
Like that I guess I wouldn't be kind of coming in as much. It feels like I'm more kind of supinating through, and I think it's more just that push-off feeling that I haven't done that in so long that.
Uh-huh.
Yeah.
And just for the purpose of anyone
Good.
who's watching this video once we post it, tell us who you are and what you do.
Troy Zivian, I'm 42 years old and I'm a physical therapist. I do outpatient physical therapy, and I've had my feet and ankles mobilized with traditional AP glides and a lot of stretching, but I haven't had a response like this ever.
So what's different about this?
I would think it's probably just proper glides for the joint. It just feels like what you were doing was what it needed.
Okay, was it
wasn't any
duration? Was it amount of
resistance.
force?
I'm sorry?
Was it the duration, the amount of force, the number of times, the sequence? I don't know.
I think it was proper force, kind of in the way that it felt like it needed to go. There wasn't any real discomfort. It was almost pleasant, I guess. It felt like it's what it needed.
Yeah. So do you feel optimistic you'll keep this?
Yeah, I do. Yeah, my feet haven't felt like that in a long one. I can't even remember.
Neat. It's nice to know because, even though they were really rigid, every time you walked, there still was some micro motion in those joints. So they didn't ankylose. They didn't, they didn't fuse together. There was still some movement of synovial fluid. And maybe the other thing I did for you, let me know what your thoughts on this, but maybe I treated it in a sequential pattern. Has that been done to you? Each and every one of those motions addressed sequentially?
No, I mean, I've never had it in that pattern before.
Okay.
That you did.
Yeah.
So if
See,
there's-
I think the foot and ankle is complex enough, but it has predictable patterns. And when someone lives in supination like you do or did, I think you need to do everything that I did and in that order. I think there's a wisdom to the order, the sequence of it. And maybe, I did like 30 oscillations on each mob. I don't know if you had that number done previously.
I wouldn't think so.
Yeah. So interesting case, and let us know. Keep us posted on how you do.
Certainly will.
And any further comments?
No, I'm interested to see what'll happen when I, do some activities, running, jogging, lateral movements, things like that. It's
Very
easier
good.
for me.
Very good. Thanks so much. I appreciate it.
Thank you.